Hello, everyone, and welcome. We're pleased to be here today, part of the People and Planet United Global Health and Purpose Summit. This is a global gathering that brings together leaders across health, technology, and innovation to explore how we can drive better outcomes for both people and our planet. Today's session is Building Rural Health Resiliency. We're going to explore how innovation, partnerships, new models of care can help us strengthen health systems in rural communities and improve access to care in underserved areas. I'm Nicole Cottrill, Managing Partner and Health Provider Services Lead, and I'm so pleased to be opening our session and introducing our speakers. We have today Dr. David Rhew, who is the Global Chief Medical Officer and Vice President of Healthcare at Microsoft. He leads efforts that are at the intersection of technology, health systems, and clinical innovation. We also have Laura Kreofsky, who is National Director of Rural Health Resiliency. And she focuses on improving access to care and strengthening health systems in rural and underserved communities. These two, as a team, bring a powerful perspective on how technology, collaboration can help us build more resilient and equitable health systems across our nation. So let's start by learning a little bit more about you, Dr. Rhew and Laura. So tell us about your backgrounds, your roles, and how your work at Microsoft today intersects with the wild and wonderful world of rural health.
Well, thanks for having us. Again, my name is David Rhew. I'm the Global Chief Medical Officer for Microsoft. I'm a physician, a technologist, a health services researcher, and I've been in the healthcare technology space for over 3 decades. A big area of interest for me is trying to understand how technology and specifically AI can be used to increase access to care, improve quality of care, allow for individuals to become much more understanding of their situation, of their health, and really to lead to better health outcomes. A big area of focus also has been on rural health. There's really two areas that I'd say that are intersecting with rural health. One, I helped organize and co-chair an initiative around responsible AI. It's called the Trustworthy Responsible AI Network, working with a large number of healthcare providers across the globe, in the United States, well over 70. These are academic medical centers, health systems, but also rural hospitals and rural communities and federally qualified health centers. A third of them are in rural America. And the goal is to understand how can AI be deployed in a way that fosters trust, that allows us to be able to do it in a way that is responsible. And so that's one area. And another more recently is called the Rural Health Transformation Collaborative, or RHT Collaborative. It is something that a large number of organizations realize that we as technology companies, as healthcare providers, as enablers can help communities in rural America to be able to better understand how to be able to take the technology and apply it in ways that will lead to better health. So I'm real excited to be here. Thank you for allowing me the opportunity.
How about you, Laura?
Yeah, and thank you again, Nicole, and everyone for this opportunity. Like David, I've been in healthcare and healthcare IT for over 3 decades. I'd like to say for a couple of centuries because it's technically true. And just been always enthralled by the constant innovation, the constant change of the field. I've worked a lot in healthcare tech and also on the operations side. And a really big through line of my career, if I look back and look forward, has always been around working with underserved organizations, from federally qualified healthcare centers to I spent a few years working for a state department of health that specialized in behavioral health and care for the severely developmentally disabled. And then I sort of did a lot of work in rural healthcare across the country and just got to spend time in those communities, which was really incredibly valuable, impactful. And have returned to sort of that area of my career with this role with Microsoft. And as you mentioned, Nicole, I lead the Microsoft Rural Health Resiliency Program, which is a mouthful, but um, and it's an initiative Microsoft Philanthropies started about 3 years ago, really in partnership with the American Hospital Association and the National Rural Health Association to help bring technologies, offers, and discounts to rural America, to rural providers. And We started with cybersecurity because at the end of the day, if you don't have a secure and stable technology foundation, you can't build, you can't go, to the next level without that. And then over the last couple of years, we've really leaned into AI and innovation and helping rural healthcare organizations um, have the tools and the technologies they need to be innovative and to evolve with the times.
Well, I mean, it's certainly, rural health has been in the news a lot recently. And just for, some of our viewers here who might not be as familiar with some of the challenges and opportunities in rural communities today, could you just give us a little bit of a landscape overview? We know that rural healthcare providers, hospitals are such a vital resource to patients, in the communities that they operate in. But, tell us a little bit about those communities, sort of the scope of the impact that providers have, the fragility they're faced with every day. What's that overall stage look like?
Yeah, and I think you nailed it. They have such an important role in the communities. Sort of across the United States, rural healthcare organizations serve about 20% of the population. So it's very impactful and it's a critical piece of our overall, I call it the healthcare ecosystem. But it's been handicapped by a number of factors. Statistically, patients are older and sicker. And across rural America, there's just been endemic workforce shortages from physicians to nurses to technology staff. Also, from a financing standpoint, hospitals and healthcare organizations in rural communities have higher fixed cost. Many times they just don't have the volume, right? So they have these sort of operational anchors to work with. Uh, then, in addition to that, we have the challenges of insurance payments and the recent Medicaid cuts. And these are just a few of the things that are really that rural healthcare organizations are facing. And what it means sort of downstream to a technology and an innovation standpoint, they have older systems and limited technologies, and they have a shortage of time and talent to really put into innovation, right? They're wearing many hats and they're often under-resourced. And then what we see is a sort of vicious cycle. And between the workforce shortages and the financial challenges, today about 40% of rural hospitals across the US are in at risk for financial reasons for closing. So it's been a pretty bleak scenario for a lot of organizations. Now we'll talk a little bit about the Rural Health Transformation Fund, which
Mhm.
we are cautiously optimistic will help that. But it's a pretty dire situation for a lot of hospitals.
Yeah, and just to build off of that, and maybe I'll focus on the providers and the physicians. We know, independent of rural healthcare, that there is a clinician burnout issue. About 50% of clinicians, we're talking about doctors, nurses, pharmacists, a large number of them are burned out and many are leaving the practice. So we already have an issue nationwide that is impacting the workforce. And then you look into the rural space and it's even worse. Not only do we have the high amount of administrative burden because the technologies and the infrastructure is not there, so a lot of it falls on the clinicians, a large number of patients that are coming in that need to be seen. And it's ultimately something that a clinician trying to manage all of this it's extremely difficult. And many clinicians they don't have enough availability for them. So I think the scarcity, the burnout, the isolation, all of that, the lack of the technology contributes to that. Now, the good news is that there are mechanisms right now for us to be able to better understand how we might be able to empower the clinicians with tools that can help them become more efficient. And additionally, there are new approaches that allow us to rethink like who is providing the care? Can we expand the capabilities so that it's not just the physician, but it's nurses, nurse practitioners, physician assistants, pharmacists? A large number of organizations are starting to think our workforce needs to be more than just simply the physician providing the care in a clinic, but how can we leverage the entire healthcare team and empower them with AI and tools to be able to make them successful?
Well, so let's talk a little bit about those tools. I mean, you've I think laid out very well, a lot of the persistent challenges that rural providers, face today. Sort of, structural policy, reimbursement, and beyond. And if we look at digital platforms, AI as sort of part of an answer, what does that look like? And what do we need to have in place to really create, long-term sustainability.
Yeah, well, it definitely starts with the infrastructure. And the challenge that we have is that in many places across the country, specifically in rural America, we don't even have the connectivity. So you need to have, if you want to leverage the digital technologies, the cloud, the EHRs, the digital solutions that we have with remote patient monitoring, telehealth, connectivity is a starting point. And then from there, the data has to be managed, stored, protected. There's a level of opportunity for us to be able to start thinking about putting that level of infrastructure in place. Now, again, the good news is that there have been some recent announcements and partnerships that Microsoft has been a part of that have allowed us to be able to address some of those connectivity issues. Recent announcement around working with one of the leading low Earth orbit LEO satellite companies has allowed us to be able to provide connectivity and cloud and cybersecurity to anyone across the United States, and more specifically in rural America.
Right, that's great. I mean, and that infrastructure point, I mean, is such a challenge, and to have a solution to that, would make a big difference in so many areas. What's your take, Laura?
Yeah, I think, David nailed it from an infrastructure standpoint. If you don't have that, it's really hard to go anywhere sort of beyond just sheer survival. But I also think there's a number of human elements that we need to think about in all of this change. And in my opinion, they are as important, if not more important, than driving this change in innovation. When I talk to rural hospitals and healthcare organizations, and I'm out in the field almost weekly, one of the biggest top of mind topics is really having the know-how and the tools to evaluate and govern AI, honestly. It's a desire to be equipped with those the current insights that David mentioned, the responsible and ethical AI network, and some of the frameworks they've put out in other organizations. Really, just the explosive growth of this technology and its profound impact on healthcare is just, I think, has a lot of people extremely concerned what it means to them as professionals, what it means to their healthcare organizations, and ultimately, particularly in rural communities, when the hospital, the healthcare organization is, kind of the anchor of the community, what it means to them as a community, right? And people, we have healthcare and we go to our providers and we stick with our primary care providers for years, if not decades, because of that personal relationship. And they don't want to lose that. And I completely understand. So in rural America, as in many places, I think everybody's really racing to better understand and to govern and adopt AI and advanced tech in a responsible and ethical manner.
Well, and I think there's something interesting, and you mentioned it earlier, Laura. There are programs in place, right? You talked about the Rural Health Transformation Program, right? Because I do think one of the things, from a resourcing is a big part of the challenge, right? And there are programs like this that may help us bridge the gap and give providers, additional tools to help them look at how they can adopt AI. So let's just dive into, what's happening with RHTP. And, I know you all have spent a lot of time sort of looking at that program and, what's happening on the field and what's of interest to providers. So what do you really see as being some of the most promising initiatives and technology that could emerge from that program in different places across the nation?
Yeah, maybe I'll start. I do
Perfect.
think that we have an opportunity to be able to apply AI to solve some really extraordinary problems, things that go well beyond even just rural health. Just in general, we know that the rising cost of healthcare and access to affordable healthcare is a problem across the entire nation. If you think about that, you've got 5% of the individuals in a population responsible for 50% of the cost. 20% responsible for 80%. So how do you find these individuals before they actually get to the point where they're having a stroke, they're having a heart attack, they're having some kind of catastrophic event that ultimately leads to a cascade of really bad things for both the patient as well as the system. And so our objective is to think about how do you become proactive? Well, to me, one of the most promising areas is around using AI to screen large populations, find individuals that are high risk or about to have some really bad events, and bring them to care right away. And we've actually seen this. AI can be used in a variety of different ways. We can use it to first search the medical record and find these type of patients that are high risk. We can use this to be able to use voice as a biometric to identify individuals with behavioral health challenges. And we're not talking about what they're saying, but just how they say it. But we can also use AI just on a routine thing such as an eye exam, a routine retinal exam that we all have had eye checks. The machine that traditionally captures it, the data has been on the machine. It's now moving to the cloud. With that, we can run AI on top of it. And we're starting to see huge opportunities to be able to find these individuals that have these really bad diseases that are advanced and bring them to care. Great example is in East Texas, in a rural clinic there, they deployed the retinal screening as part of a routine when people come into their ambulatory care clinic. They would just, with their vital signs, they'd get the eye exam. It takes 2 minutes, non-invasive, really simple. 20% of the individuals, one out of every five individuals that had this exam, had advanced stage, moderate to severe diabetic retinopathy. If untreated, would lead to blindness. Many of these folks had no idea that this was going on. They measured the hemoglobin A1C, the measure of their blood sugar. It was 10.5%, which means that their diabetes was out of control. So these are individuals, I call them ticking time bombs, because if untreated, will ultimately have some really catastrophic event. And in this case, it would be blindness. So those 20%, now they've been identified, and now that we're finding a way to get them back into to treatment. But that's what's exciting, because the AI can find these individuals that really need the care and bring them to care. And to me, that's one of the most promising things about these technologies.
Yeah, that's amazing. That example from East Texas is I mean, it just shows the potential so well. I know, Laura, you said, I mean, you're on the ground every day with providers across the nation. What are you most excited about?
Well, sort of stepping back and thinking about the rural health transformation program holistically, there were really 11 initiative areas in it, and everything from cyber and infrastructure to AI and innovation to, as David said, population health and chronic disease management. But the initiative area that the most states responded to as something they planned to fund was workforce development and workforce upskilling. And I think for me, that is one of the most exciting things because, as David said, there's just such a shortage of folks. Now, on the flip side, for a lot of states, this translates into a multi-year effort to train and recruit and retain more healthcare providers to rural areas. And, this is a situation where we really don't have the luxury of that much time. And so I've also seen some really cool things about states that are investing in real-time programs to not only skill the next generation of healthcare workforce, but also to upskill current workforce in AI and informatics and new technologies. Because really, when we can keep people in the workforce, that is a huge win because they have the experience and the skill, and they're also just those mentors and those leaders for that next generation that's coming in. So I'm really excited about what I'm seeing some of the states do in terms of investing in, I call it digital literacy. And that also, at the end of the day, brings efficiencies into the patient care and operations. I'll also say I've seen some really cool things happen on the private sector or the private public partnership side. The Microsoft Rural Health Resiliency Program, I think, is a great example of that. And we've really leaned into focus on AI training. But there's also other organizations like Johnson & Johnson and Google and others that are really stepping up to focus on how do we upskill that workforce. And then I think finally, from another sort of angle on the Rural Health Transformation Fund, I work a lot, as I said, across the country, but a lot of times with the independent hospitals or health systems out in the middle of nowhere that they're not attached to a large healthcare organization. So these are really, again, I go back to that concept of the anchor in their community. And most of them want to stay independent. So what I'm seeing is a lot of focused effort to create collaboratives or to regionalize in working groups, banding together. These hospitals, these healthcare organizations, they share resources, they negotiate payer contracts, they're sharing their data, using cloud technologies to work on population health. Ultimately, I think this is going to be very helpful to their survival as individual or independent organizations. So, while it's not the two things I reference are not exactly hands on the patient, I think they're really fundamental shifts and important investments that are being made because of the Rural Health Transformation Program.
Well, and it seems like one of the greatest values of this program, to your point, is it's creating collaborations and creating opportunities for collaborations that organizations might not have even thought of before, right? Provider to provider and, innovator to provider and community organizations. It seems like there are doors being opened, which is a positive thing. And it's interesting. I mean, obviously, one of the reasons this conference came together is we're talking about purpose and global impact. So I'd love to hear from you both, with this idea of, kind of collaboration and how we all come together in mind, where do you see technology companies like Microsoft, what's your responsibility, especially on the AI side, to really ensure that we're collaborating with providers and folks on the ground in the right way so that AI innovation is being deployed in a way that really meaningfully improves outcomes in these communities where these challenges exist.
Yeah, I'll start. We are already seeing that there are many organizations, not just technology companies, but healthcare providers, payers, a large number of folks that are enablers working together around an effort to try to provide opportunities within rural communities. The Rural Health Transformation Collaborative, or RHC Collaborative, is a great example of that. This was co-chaired by Microsoft, a group called Cibolo Health, which manages a large number of rural hospitals, the National Association for Community Health Centers, which a third of these federally qualified health centers, which are part of that NAC, are actually in rural America, and really an innovative company on remote monitoring called Biointelligence. These are four companies that work together to be able to pull together a large number of other companies and organizations to be able to provide the infrastructure. We talked a bit about the connectivity that is now available through the satellite, the LEO, the low Earth orbit. We've got the cloud and the EHR capabilities, the cyber protections, and also the AI and the solutions. And all these amazing solutions, they all work within I guess, an ecosystem of different types of opportunities for states to be able to take advantage of. Now, to me, that's a starting point. You've got the ingredients to be able to do some core things. But what is also necessary is we do have to think about how we can enable the individuals within rural America to be able to get the care they need in a timely manner. I had the opportunity to do the kickoff at the Alaska Rural Health meeting, which was in early January. And what I learned in talking to one of the CEOs was that a lot of the hospitals in rural America are not like the hospitals that we envision in some of the other parts of the country. They don't have a lot of the specialty services. They don't have the surgeries. They don't have even things like ophthalmologists to do diabetic retinopathy treatments. And so these individuals have to hop on a plane and fly from Alaska to Washington to be able to get a lot of these services. So what now we're starting to think about is, can we find a way so that the people don't have to go and hop on a plane every single time they have some kind of a condition? Because you think about the conditions today, there's three things that happen with a visit. There's a diagnostic component, there's a management component, and then there's a procedure component. Well, the procedure, it might be difficult to be able to set up, these surgery centers in rural America, But the other two, we could certainly move over. We're starting to see that the ability to do diagnosis with a variety of different sensors and imaging techniques like the retinal image with applied with AI can allow us to be able to have those eyes and ears on the ground and understanding that. And then the actual management can be done through telehealth and remote patient monitoring. So those two aspects could be done in rural America while you reserve the individuals that need to fly to a place to go and actually have the procedure done, as opposed to, and this is probably what happens a good number of times, you come in, evaluation, things look good, we'll see you back in 6 months. That's really not possible for a lot of these folks. You really do have to kind of disintermediate those. So to me, there's a significant opportunity for how we think about not only the key partners, but also how the partners can work together.
Yeah, and Nicole, I think you brought it up, right? There is this we're the rural health transformation program and kind of the state of the rural health market as a whole has spurred a lot of collaboration and innovation and different models, right? And a lot of tech providers, a lot of professional services company, a lot of have stepped up into this space because of the rural health transformation program. And admittedly and honestly, I think we have to be really sensitive to that because a lot of rural health providers are like, yeah, this is great because I've got $50 billion in my checkbook right now. But where were you then and where are we going to be in 5 years when this money goes away? And so I think there's legitimately some sensitivity to that. And so I think the partnerships and the programs that are going to be most successful and are those that are going to be most trusted. And in rural America, that's a really important factor in your community, right? Your neighbors have your back and in your healthcare systems. And that translates over to working relationships with vendors. So again, I think when anchor institutions like Microsoft or satellite bandwidth providers step up and say, hey, we really want to make a meaningful impact and we're going to put some skin in the game and we're going to help you take sort of these leapfrog advancements, I think that makes a really big difference in building that trust. Also, and I hate to admit it, but I read a lot of the state's rural health transformation program applications, a little light reading over and over, in those applications, states talked about, we've got to figure a way to sustain this. This funding, whatever we put in place, cannot die on the vine in 5 years. So we want to build programs smartly and in partnerships with organizations and vendors that can help us, really keep this going. And I just want to go back to the concept of broadband and because David's talked about it a couple of times, but it is just so fundamentally important. In fact, before I started this role 3 years ago, I didn't realize how profound sort of the differential was in terms of underserved and rural communities and the impact. And you might be familiar with a Kaiser Foundation study that came out last year around dead zones. David, did you see that article? Maybe. Anyways, they looked across the US and found 200 counties in the states where not only was there a health professional shortage, there was also a lack of broadband. And they dubbed these 200 counties um, dead zones, right? They don't have healthcare providers, they don't have access to, telehealth or other technologies like that. And what they found is that the 3 million people in these areas have more illness, they are sicker, and they die younger, simply because of a lack of access to healthcare. So that's why when hearkening back to the beginning of this conversation, started talking about infrastructure, started talking about growing the workforce. All of these things feed together in terms of a longer term sustainable roadmap for rural healthcare.
Yeah, I mean, and that phrase "dead zone," right? I mean, it's bad enough when we call them deserts, but I mean that really puts a finer point on it. I mean, and it ties together how much healthcare access is tied into all other kinds of access. And, it is, and you both have said the word infrastructure several times. That really is a critical part of what we're building in so many ways, to make sustained improvements in these communities. I do want to pivot here because we've talked a lot about AI and the potential for, gains that AI has helped to make in healthcare already. But I think there's always some interest in sort of, where the rubber meets the road. Because AI is talked about a lot in theory, not in practice. So I'd love for you to talk about, from what you're seeing on the ground, what are some AI wins that have already happened? And, for the folks who are going to be watching this who, are curious of, how do I really make AI work in a real world rural health setting? What made the deployment in those wins successful?
I can jump in and
Yeah,
start, and then David, if you want to add some
sure.
our experiences. I'm going to shift gears a little bit because we've talked a lot about the clinical side of healthcare, but I'm going to flip it over to the financial and the business side, and talk about everybody's favorite topic, which is denied insurance claims. Right? They're, I mean, a huge problem in healthcare. And the AHA published a study a couple of years ago that says it costs us like $19 billion a year to process and fight and fight and process and fight these denied insurance claims. And the impact can be devastating to individuals and their families as they work through this. It also takes a ton of time and specialized talent to know, on the provider side, how to negotiate and navigate the different insurers' policies and protocols. And so last year, as part of the Rural Health Resiliency Program, we convened a group of hospitals from across the country, rural hospitals of different shapes, sizes, and flavors, and said, hey, where could we deploy low or no code AI to really help you? And they, not surprisingly, everybody said, help us with our revenue cycle. And so we narrowed that down and narrowed it down and narrowed it down. And I think that's a really key piece of the conversation about AI success is small, right, incremental wins. But we narrowed this down and worked with these rural hospitals to create a low code tool called the Claims Denial Navigator. And really what it does is it helps billing staff sort of sift through all of the documentation and all of the Medicare and Medicaid payment guidebooks to quickly research and surface recommendations on how to resolve a denied insurance claim. And two things I love about this tool, well, lots of it. One, it was built with and by rural providers, but really importantly, I think in the adoption of AI is that it doesn't replace professional judgment of those claims specialists. I call it just sort of reduces the clutter and the cognitive load if they have to think about those 400 variables that go into why this claim might have been denied. And I think it's a great example of how AI can work shoulder to shoulder with those specialists. And the second thing I love about the Claims Denial Navigator is we put the code out on, once we finished it, we put it out on GitHub for free. And so any healthcare organization can pick it up and use it and for their own internal needs. And we've actually had some state hospital associations pick up the code and they're tailoring it for their hospitals to choose to use if they choose to do so. So, I mean, that ties on in a lot of these key concepts, but really using AI to hit a targeted pain point and to help the individuals, the end users, adapt and acclimate to a way that doesn't feel threatening. I think that to me has just been a real success story.
Yeah.
Amazing.
Building off what Laura said, when we had an opportunity to talk to a lot of the rural healthcare providers, the first ask was help us with a lot of the friction points. And clearly the denials was a big friction point. Another was just the amount of administrative burden required to just document and put things into the electronic health record. This is something that in many ways has been a very laborious, manual, time-consuming effort. And even the documentation and the things that were put in were not very complete. which then led to a number of the claims being denied. So what we found was that there's a real synergy and or a real opportunity to be able to then look at the way that we capture the information and using AI through something called ambient voice to convert that voice conversation that a patient has with the clinician into a note. So it's not just a transcription of what's said, but it was actually a conversion of the transcript into the format of what a note should be. It accurately summarizes it. It allows us to be able also to be able to ensure that everything that's been captured has been captured, to be able to provide the right billing code potentially, so that because you've got the right capture, but also to document all the necessary things. And it saves the clinician a tremendous amount of time. It decreases burnout and it creates a great patient experience. In fact, in the surveys that we performed with a lot of the providers that use these ambient tools, they found that the burnout went down dramatically and consistently, and also the patient satisfaction was quite high. So we know that this is a very valuable tool. This is something that I would say is probably a low-hanging fruit for rural health providers to be able to provide this. And it could be used in so many different settings. It could be in a clinical encounter where you're in an ambulatory setting, but it can also be done things for like with nurses. Nurses actually then documenting in a hospital into the EHR. They can use this tool almost like a dictation. They just talk into their phone and it takes their conversation and it organizes things and it puts it into the right fields in flowcharts. And so these are the types of technologies, that ambient voice, that can be extremely valuable for any provider, but more specifically those that have the heavy burden of administrative loads, such as those in rural health.
Those are both such great examples of not just sort of good use of technology, but I mean it's leveraging technology in a meaningful way to help people be more efficient, more effective with their time, to reduce administrative burden, emotional burden. I mean, so many things that come with work in healthcare. And the thing that strikes me about what you've both demonstrated with these two examples is that this isn't just about sort of shoehorning technology into everyday working environments, but this is really a way to look at how we deliver care differently, right? I mean, I would love to hear from you, based on what you're seeing and what you know is possible. um, you know uh, how can we think about reimagining healthcare delivery by leveraging AI in more and different and better ways? But also to that workforce point, are there things we can be doing today, to help upskill, train, prepare our workforce to operate in more AI-enabled environments?
Yeah, right. I mean, such a great question. And actually, this is perfect timing. Yesterday, I was in Idaho at the Rural Health uh, annual conference, right? And we did a survey. We did two surveys, one before the conference, so it was sort of anonymous, and then one kind of show of hands at the conference about how people felt, individuals felt about their readiness to embrace AI. And then we also asked after that question, like, what about your organization? And we both did it anonymously, and then we did it in the room, just for conversations. And I would say just in the last year, I've seen a shift in people feel more receptive or more resigned, depending on the adoption of AI into their workforce, into their roles, right? They have a lot of questions and they have a lot of concerns, obviously, and around security and confidentiality and how to manage this, how to govern this. And I think that that's going to continue to to be a theme and for the next few years as we sort through and really um, work together to put the guardrails around AI, because it is such a powerful tool. Um, But alongside of that, I just finished reading a book called Open to Work, and it was written by the CEO and the Chief Growth Officer of LinkedIn. And quite honestly, it was more thought-provoking than I thought it was going to be. And one of the things that really stood out for me in the sort of way we think about changing our paradigms with work is this concept of, I think they called it onlyness, right? So there's a lot that AI can do alone, and a lot of AI can do side by side with people. But then there are these competencies that only people can do, right? Compassion and creativity and communication. Um, And it's a combination of our passion, our talent, and our experience. And I think that's what's really going to be kind of a vital attribute of individuals and fields is really tapping into that onlyness of what they do going forward.
Yeah, when people think of AI, my feeling is a lot of times they look at it from the perspective of, oh, I've got this thing that I'm working on. AI, can you help me do it or maybe do it better, faster? And then people look at the result and they go, wow, AI did a great job. We don't need the human anymore. We're just going to use AI. And that's part of the reason why people have said, oh, is AI going to take away my job? Well, to me, that thinking is not really the right way to think about these problems because the reality is we don't have enough clinicians. We don't have enough resources in these low resource settings. To remove those resources would be like taking away your most valuable player. What we really do need to think about is this concept of augmentation and redefining workflows. So let me give you an example. So in the emergency department, well, actually, I have a work colleague who shared this story. He had an uncle. His uncle went to the ER, had severe abdominal pain, and ultimately he died in the ER waiting for treatment. Now the CAT scan that showed that he had an abdominal CT, and before the aneurysm had burst, that's how he died. It showed that the aneurysm was there, but it was in the queue to be read by the radiologist. AI could have helped us as soon as it was done, identified this and brought it to the top of the queue and allowed us to be able to act quite differently. That's where AI plus human, a different workflow can lead to different and better results. Now, if you would have just simply said, I'm going to replace the radiologist with the AI, maybe it could have gone through that queue and eventually got to that person. But what you really do need is this combination of AI working with humans. And to me, that's what we need to be starting to think about. How do we get the workforce? How do we get organizations to think about how do we work together with AI? In the world, in the future world, we may be finding that our entire workforce is both humans and agents working together. And so we have to think about how do we then design a workforce around that. I think there's really three steps to get there. The first is just around giving people a basic education of what AI is. I mean, people may see AI as ChatGPT, and that is a part of AI, but there's a lot of other types of AI. People need to understand responsible AI. People need to know what agents are. They need to understand, how to manage agents. So to me, that's like the first part, education. The second is skills, just getting people to be able to use this and understand how to use AI effectively. And that's an important part that's built on top of that. And the third is really workforce enablement. So you're looking within a workflow, understanding how this AI can be applied. You're mastering it, you're demonstrating results. And now what we're going to do is we're going to hire people to be able to do that. So it becomes a jobs opportunity, a skilling and an upskilling and a reskilling opportunity. And that's what we have to start thinking about across every domain, whether it's rural health, whether it's in just non-rural health. But to me, that's where the industry is going, and we have a tremendous opportunity to be able to take advantage of AI. But we need to be able to think about it in the right context.
I love that. I was at a conference earlier this week, and one of the innovators who spoke said that the best technology amplifies human intention. And I thought that was a really nice concept in
Yeah,
that, we can do all this great technology, but if it's not sort of, working with, humanity in a meaningful way, it's never going to be successful, right?
yeah.
I mean, and those were such great examples, and I really appreciate that framework, David, because that is, I mean, how we really have to think about the future. Um, we're getting close to the end of our time here. So let's talk for a minute just about the future. This is a little pie in the sky, but sitting where you are today, there's so much potential out there, so many, could do's. But if you were going to deploy in a rural health setting tomorrow, one AI or tech enabled capability. It could be clinical, it could be operational, it could be workforce. If you waved your magic wand, what would you choose?
Yeah, maybe I'll give Laura the final word, so I'll jump right in. When I look at how AI is being applied, I oftentimes think of it as, oh, I have a problem, I'm going to use AI to solve it. But to me, that all that does is it exposes the problem that's just down the stream, the next problem. And so unless you think about it from an end-to-end workflow and thinking about how AI can be applied across the whole workflow, we're not going to be able to solve these problems. So for instance, when we talk about like the whole population health with the AI screening for the retinal, there are tons of AI today that can allow us to find the patients. But the issue that we're running into is that there's not enough providers to be able to manage those patients. So immediately the issue is how do you do more with less? So what we've learned is that the next phase is around risk stratification, triage, and building capacity. Okay, and so then you've got like, oh, I've built a capacity. Then it exposes the next problem down the road. What about the patients? Do they have the ability to actually see the doctor? Do they have the resources? Are they engaged? Do they understand what needs to be done? And so really in this process, there's three things. There's finding the disease, there's managing the disease, and there's engaging the patients. And unless you do all three of them, and AI can help in all three, you can't solve the problem. And that to me is why I am really excited about this ecosystem approach, because we do have partners in all three of those categories. If we can find a way for us to be able to stitch workflows together that allows the patient to flow seamlessly through these different workflows, we can actually solve these big problems.
Yeah. There's an area of the sort of healthcare ecosystem that we really haven't touched upon, but it's kind of near and dear to my heart, and it's around sort of behavioral health and substance abuse. I've spent a lot of my career working in those types of organizations and with them, and know it's probably one of the the hardest and most heartbreaking areas of healthcare, right? Because you can see just human potential on the line, if you will. And David kind of lined that out as if we can use AI tools to surface and manage and engage the patients in just that one subsector of health and wellness. I think it's honestly it could be the biggest advance in public health and in the century, right? And I'm excited about that. There's a lot of work being done in behavioral health with technology and AI, and I think the models and the tools and our approach isn't perfect yet. But I do think over time it could be very fruitful and be very valuable for families and their patients and ultimately communities.
Yeah. Well, and such a critical area with so many shortages and so many access challenges.
Yeah.
Um, so I mean, great. I mean, and so that's a great closing word, Laura. I think if anything stands out from this discussion, and thank you so much for a very thoughtful and insightful discussion, but I think this idea of building rural health resiliency, I think if anything is clear from this, we know it's not just about access, it's not just about one technology or another, it's really about collaboration across so many stakeholders and rethinking about how we deliver care, how we strengthen partnerships, and how we ensure that innovation is reaching communities and the workforce in ways that are practical, and to Laura's earlier words, sustainable. Right. So, I mean, I think this discussion has really highlighted the importance of how we align, technology and care delivery and community needs to create systems that are really responsive and resilient. I mean, that's where the best in change happens. So, thank you so much for your time, for your insights. This has been very exciting. So, thanks.
Yeah, Nicole, thank you. And Dr. Rhew, thank you.
Thank you, everyone.